Hello and welcome to my review on antibiotics. My name is Hannah Trout. I am a certified family nurse practitioner, and I will be going over some of the ways that I remembered my antibiotics for my board exam. This is primarily a review for ANCC, AANP, as per Leak and Fitzgerald. But you could also use this to study for the NCLEX or just any nursing exams in general. So the first thing to remember is bactericidal versus bacteriostatic. Some antibiotics are bactericidal, which means that they kill bacteria. So the way that I remembered this is that if you're watching a crime documentary on a homicide, the side part usually means involving a murder. So in this case, it's murdering bacteria. Then we have bacteriostatic, which means to prevent growth of bacteria. And how I remember this is I think of the static on a television, which prevents you from watching a show. So the static is preventing growth and the cidal is killing the bacteria. So I didn't really receive any questions like this on my board exam. However, it is important to know, especially for nursing exams, they will quiz on this. So bacteriostatic antibiotics include your macrolides, clindamycin, sulfonamides, and tetracyclines. Linezolid is also a bacteriostatic one, but we don't really commonly get tested on that one from my experience. How I remember the bacteriostatic antibiotics is by remembering my continually static television. So the M in my stands for macrolides, the C in continually stands for clindamycin, the S in static stands for sulfonamides, and the T in television stands for tetracyclines. As you can see on the slide, I have listed the medications that are within each class. So the macrolides include your mycins, so azithromycin, clarithromycin, erythromycin. Your sulfonamides include your sulfa medications or Bactrim, and your tetracyclines include doxycycline and tetracycline. So the first medication that I'm going to start with that is in that bacteriostatic antibiotic class is tetracyclines. These ones are a little bit easier to remember because they end in cycline. So we have tetracycline and doxycycline being the primary ones that we need to recall in this class. Uses for tetracyclines include treating gram-negative pathogens as well as MRSA and atypical pneumonia. Some adverse effects of tetracyclines include teeth discoloration, bone disturbances, liver damage, vestibular toxicity, which has to do with our ears. As you can see up in the corner, I put a picture of the ear, kidney damage, photosensitivity, and esophageal irritation. I have some key points for us to remember on the right side of the slide. First one is to avoid in children less than 8 years old. So I've put a picture of a crying child up in the corner, and this just kind of helps with my visual learners. We want to avoid it in children because it can cause issues with their teeth and bones, which they are growing at a crazy rate when they're less than 8 years old. So we just kind of want to remember if a question poses if we should give a tetracycline to a young child, we should never give it to a young child. We want to remember that our patients should wear sunscreen and avoid UV rays, as this medication can cause photosensitivity and your skin can become damaged if you don't do that. So I put a sunshine up in the corner as well. We want to remind our patients not to take dairy or antacids with their tetracyclines because this can reduce the effectiveness and impair absorption of the medication. And if you've taken pharmacology, you probably recall that a lot of medications we do not want to take with antacids for the same reasons. So I have put a picture of cows up there just to help us remember dairy. Next would be we want to remind our females of childbearing age that they should use backup contraception, as tetracyclines can reduce the effectiveness of their oral contraceptives. We also want to remind them that this medication is teratogenic, which means that it can affect the fetus. It can really harm them, so we don't want to give it to childbearing females. And we also want to remind our patients to take this medication with a full glass of water. As mentioned before, this medication could cause esophageal irritation, so that is why we want to do that. Okay, so here are my silly tips for remembering my tetracyclines. I want you to think about the word cycle. So first, before you cycle outside, you should put on sunscreen to protect your skin because you're going to be out in the sun. You know, we want to make sure that we don't get a sunburn. So this helps you remember the photosensitivity aspect of tetracyclines. So we want to remind your patients to avoid UV rays and use sunscreen. The next tip is after you cycle in the woods, you should check yourself for ticks. So tetracyclines are first line for Lyme disease and Rocky Mountain spotted fever, both of which are tick-borne. So that's a helpful way to remember that. That's often tested, especially on the ANCC and AANP exams. Next, if you fall off your bicycle, you may harm your teeth and bones. So teeth discoloration and bone disturbances are common side effects of tetracyclines, and we want to remember that with our young children, especially to have them avoid this medication. Also, women who have a menstrual cycle should use backup contraception. So remember that this medication causes ineffectiveness of their oral contraception, so we want to make sure that they're either abstaining from sexual activity or using some type of backup method. And then lastly, children should not use a bicycle till they are older than 8 years old. So this helps you remember that they should avoid this class of medication in children less than 8. I know that's kind of silly because usually, kids, less than 8 years old probably can ride a bike, but it's kind of a way to help you remember that a little bit more. So next medication that we're going to review in our bacteriostatic antibiotics is clindamycin. So this medication is primarily used to treat gram-positive pathogens as well as MRSA. Adverse effects of clindamycin are candidiasis and C. diff. So C. diff is a huge one, so I've highlighted that in purple for you. And that is that infection which causes extreme diarrhea, and it can be really harmful, especially in older patients. So we probably want to avoid this medication if there's something else that we can give, just as it is really linked to that type of infection. So my silly tip for remembering clindamycin is I want you to think of a girl named Linda who has acne, bacterial vaginosis, and diarrhea. So clindamycin has the word Linda in it, and it can treat acne and bacterial vaginosis, which is primarily in females. So that's why I have you think of a girl named Linda. But it can also cause diarrhea. So it's not really that much of a helpful tip, but it's kind of a way that I remembered it. I don't know, it worked for me, but there's probably some better tips out there. But yeah, you can use this one if you want. The next class of medications in the bacteriostatic antibiotics is macrolides. These are medications that end in thromycin. So we have azithromycin, chlorothromycin. There's a few others, but these are the main ones that I want to focus on. The primary uses for these macrolides include atypical pathogens. So this includes your pneumonia, your skin infections, acute otitis media, especially if the patient is allergic to penicillins, and chlamydia. Adverse effects of macrolides include QT prolongation, that is a big one, they might test you on that one, and LFTs elevation, and nausea, vomiting, diarrhea. So primarily in practice, we will primarily just see the GI side effects of these medications, but for testing purposes, as I said, we want to focus on the big things. So the QT prolongation is a good one. You want to use caution in your patients with heart disease, liver disease, and myasthenia gravis. That's kind of a weird one that they did mention a lot in the Leak and Fitzgerald textbooks when I was studying. I didn't see it on my exam, but I could see them testing on that. With the caution with heart disease, obviously because of the QT prolongation, if your patients have issues with like arrhythmias and things like that, we want to avoid this medication if there's something else that we can give instead. Liver disease we want to avoid or use with caution just because the medication can cause LFT elevation. So we really want to be monitoring that in our patients that have liver issues. Some med interactions to remember. This would also probably be tested on because macrolides have quite a few med interactions. Warfarin, it increases the levels of statins. This is just because statins can raise your LFTs. So if you're giving macrolides, which raise your LFTs, and statins, which raise your LFTs, it's not a good combination. But if necessary, then just make sure that you're monitoring the LFTs really closely. Digoxin, macrolides can increase the levels of digoxin, so we want to avoid that. And then antipsychotics and antiarrhythmics, because both of these medications cause QT prolongation, so we want to avoid those, or at least giving them together in a short period of time. So my silly tip for macrolides is primarily with azithromycin. We want to remember the Z's in azithromycin. Z's remind me of sleeping. So I thought the QT interval is sleeping, which also helped me think of QT prolongation, because when you sleep, everything is kind of just resting. So that helps me remember on the exam. However, I understand if this doesn't necessarily work for everyone. The next class of medications in our bacteriostatic antibiotics is sulfonamides. So these medications start with sulfa. So we have sulfamethoxazole, and then TMP-SMX, which is a mixture, which is our medication known as Bactrim. So some uses for sulfonamides include treatment of gram-negative pathogens as well as MRSA. Adverse effects include leukopenia, so a reduction in our white blood cells, G6PD anemia, also which causes hemolysis, and then Stevens-Johnson syndrome, especially in our HIV positive patients. This medication class is contraindicated in infants less than 2 months, and this is because of the hemolysis related to G6PD anemia. I didn't have that on any of my tests, but it's just something good to kind of keep in the back of your mind. You want to use a lot of caution if the patient has a sulfa allergy. They like to test on that a lot. So just remember with Bactrim and sulfamethoxazole that you want to avoid these if your patient has a sulfa allergy. You also want to use caution if you're using the medication with warfarin, as sulfonamides can increase the levels of warfarin. Now we're going to get into our bactericidal antibiotics. So this includes our aminoglycosides, including gentamicin and tobramycin, vancomycin, metronidazole, fluoroquinolones, which include levofloxacin and ciprofloxacin, cephalosporins, which include cefazolin, cephalexin, cefuroxime, and then our penicillins, primarily amoxicillin. So I like to remember this using the mnemonic, always view murder films in cozy places. It's kind of a weird way, but it helps me, so maybe it'll help you too. The aminoglycosides aren't used all that much, I feel like, in primary care or on the exam. So I'm not really going to get too deep into that. If you want to learn more about that, I'm sure that you can find some other information on either Google or somewhere on YouTube. But our primary medications in this class are gentamicin and tobramycin, which I've primarily only used the ophthalmic solution of tobramycin for some eye infections. Next bactericidal medication is penicillin. So the penicillin class all ends in cillin. So you have amoxicillin, ampicillin, and penicillin. Primary uses of penicillin are strep, which we really want to keep in the back of our mind for the exam, as you will be tested on this quite a bit. We also know that it treats enterococcus, strep pneumoniae, C. botulinum, and syphilis. Penicillin is first line for strep throat and acute otitis media. Adverse effects of penicillin are primarily just nausea, vomiting, and diarrhea, as well as an allergic reaction. So yeah, we want to remember that. Now, I don't want us to forget about augmentin. Augmentin is penicillin plus the big guns, as I like to remember it. So most penicillins and cephalosporins are beta-lactams. So they have a beta-lactam ring around the antibiotic that helps it penetrate bacteria. However, some bacteria produce an enzyme called beta-lactamase, which causes the bacteria to be able to break down the beta-lactam ring surrounding antibiotics, making beta-lactam antibiotics ineffective. Augmentin, though, is amoxicillin with clavulanic acid. So the clavulanic acid keeps the beta-lactam ring intact and allows the amoxicillin to penetrate the bacteria. So I kind of like to think of it as it's augmenting the penicillin, so it's making it more effective, making it a little bit better. So we want to save our augmentin and use that if we're having issues with penicillin, treating whatever we're giving it for. And we can use augmentin if we think that that is the case. The bacteria are producing this enzyme and we need to give something a little bit stronger. So next in our bactericidal antibiotics, we have the cephalosporin class. So these medications start with ceph. So we have cefazolin, cephalexin, and cefuroxime being the primary ones that we would use in primary care. There are a few others that you can review, but these are the ones that I'm going to focus on. The primary uses of cephalosporins are gram-positive as you're more in the first generation class, and then they get more gram-negative as you get to the fourth generation. So I kind of remember that as if you get like an A+ on an exam, you're usually like first in your class, and then if you got like an A-, then you would be further down, you'd be like third or fourth. And that helps you remember that the different generations are different in the types of pathogens that they treat. So this would primarily be your UTIs, skin infections, and respiratory infections that we would use cephalosporins for. Some adverse effects include allergic reactions, especially if the patient is allergic to penicillin. We want to really ask them about their allergies, and if you see that anywhere on the exam, I would kind of just veer on the side of being safe and not picking this one if they are allergic to penicillins. We also have nausea, vomiting, diarrhea, and C. diff in some cases. Next bactericidal antibiotic class is our fluoroquinolones. So these medications end in floxacin. We have ciprofloxacin and levofloxacin being the primary ones that we would see on an exam. Ciprofloxacin is a second generation fluoroquinolone. We use this one to help treat gram-negative pathogens as well as atypical pathogens. So with this one, you want to kind of think below the belt. So we're going to use it for UTIs and gastrointestinal infections. Some adverse effects include Achilles tendon rupture. Now this is very rare, but we want to really pay attention to this because you will be tested on it. Also tendinitis, which falls into that same category. Photosensitivity, CNS effects, so you can have some dizziness or headache. Hypoglycemia, important in our diabetic patients. And QT prolongation, important in our heart disease patients. So my silly tip for this is I like to think ciprofloxacin. So when you sip a beverage, it goes through your GI system and your GU system. So ciprofloxacin is going to treat our GI and GU infections. Then we have levofloxacin, which is a third generation fluoroquinolone. With this one, we are going to use use it for gram-positive and gram-negative pathogens, as well as atypical pathogens. So this is primarily our respiratory infections, as well as sinusitis, COPD, and pneumonia. So think all things respiratory. Adverse effects include nausea, vomiting, diarrhea, CNS effects, dizziness and headache, tendinitis, Achilles tendon rupture, and photosensitivity. So all the same as the ciprofloxacin. A silly tip for this one is think levofloxacin. We leave levofloxacin alone until dealing with a patient with history of antibiotic resistance or more severe illness. So we would never go first to this medication. Usually we would want to save it for if the patient's tried something in the past, or they have a history of antibiotics not working, or if they have a really severe issue and we need to treat it right away. So here's some more tips for fluoroquinolones. I want you to think of the word floor. So when you take fluoroquinolones, you may hit the floor due to Achilles tendon rupture. So if your Achilles snaps, you're not going to be able to stand well, you're going to fall. Achilles tendon rupture is more likely to happen if the patient is simultaneously taking steroids. You also might have issues with hypoglycemia and QT prolongation with fluoroquinolones, which if you had either of those, it might cause you to pass out. So think of the floor as well. You're falling to the floor. Next, we have metronidazole in our bactericidal antibiotics. So metronidazole is primarily used to treat bacterial vaginosis, trich, giardias, C. diff, and intra-abdominal infections. So we don't use this one too much, but if you think of like STDs and abdominal infections, then you would think metronidazole. Some adverse effects of this medication include nausea, vomiting, diarrhea, metallic taste, peripheral neuropathy, and headache. Some key points: you want to avoid alcohol, as this can cause a disulfiram-like reaction. So this would be flushing, nausea, vomiting, and that's going to be exacerbated with alcohol use. Some caution that we want to use if giving this medication is if we have a patient with CNS disorders, so things like seizures, and then also if our patient has a history of liver impairment, we usually don't want to give this medication. So my silly tip for metronidazole is I like to think say no-dazole. Really dumb, but we want to remember to remind our patients to say no to alcohol while on the medication because of that disulfiram-like reaction. Also, we can think the met in metronidazole and met in metallic. We want to educate our patients that this medication may leave a metallic taste in their mouth. I have been quizzed on this before, and we just want to tell our patients that that's normal. Lastly, we have vancomycin in our bactericidal antibiotics. This medication treats gram-positive pathogens as well as C. diff if given orally, and then MRSA. So we can use this for bone infections, joint infections, skin infections. Usually too, it's given in the hospital, not really in primary care. So we don't have to know this as much, but we definitely need to know the major things about it. Some adverse effects from vancomycin include red man syndrome, which occurs if it is given IV. So this would be flushing, dyspnea, pruritus, and usually with this medication we would just slow the rate or stop it if the patient is having these symptoms. It can also cause ototoxicity, so tinnitus or ringing in the ears, and nephrotoxicity, so we really want to be monitoring their kidneys. And on the side I have a picture of the ear just to remember the ototoxicity, the kidneys to remember the nephrotoxicity, and the red man stick figure to help remember red man syndrome. So here are my silly tips for vancomycin. I want you to think of a vancomycin. think red van syndrome, which helps you come to red man syndrome. And then also you can think vancodotoxicity mycin. So monitor for tinnitus because of the ototoxicity. Again, a little bit of a stretch, but kind of helps me remember it because it's just so weird. We've completed learning about all of the antibiotics. Last thing that I want to leave you with is just recalling your antibiotics that are safe for pregnant or breastfeeding women. So I don't have a great mnemonic for these. I just kind of have the letters. So it's your C's, your M's, N, and P. So think clindamycin, cephalosporins, metronidazole, macrolides, nitrofurantoin, and penicillin. I know some people have used the mnemonic CAMP, but I have the nitrofurantoin in here as well, which is primarily just for UTIs. And that you want to make sure to use after the first trimester, as it can cause some blood issues between the mother and fetus. So here I have everything split into a chart that breaks down the bacteriostatic and bactericidal antibiotics. I will be linking a PDF file in the comments just with these charts, and then I have all of the slides kind of broken down into a chart form along with the abbreviations that I used for things. Thank you so much for watching. I hope that this video helped you, and good luck in your studies.